COVID-19, labor and delivery, arrival, and rooming. In order to promote the safety of our patients and our staff, it's crucial to ask the COVID-19 screening questions to all patients upon arrival and to provide a mask to any patient who answers positively. This begins with labor and delivery registration.
My wife is not feeling well. She's having some contractions. She's 34 weeks pregnant.
Okay. Can I have your name and birthday?
The screening questions are fever, cough, shortness of breath, and travel.
Okay. Do you have a fever?
Yeah.
Do you have a cough?
Yes.
Do you have shortness of breath? And have you traveled internationally the last month?
Yeah, we just got back from Italy.
Okay.
Thank gosh we made it.
Please place this mask on now and wear it at all times.
Thank you.
And would you like anybody to stay with you at all as a support person?
I would like to stay with
Okay.
you.
To maintain safety, you are allowed one individual. Okay. Please place this mask on now and wear it at all times. Okay. We are going to take great care of you and your family.
Thank you.
Thank you.
You're welcome.
I'm so glad we're here.
Labor and delivery, this is Lindsay.
I have a pregnant patient suspicious for COVID-19 with her one visitor out front. Both are masked and ready to go directly to a negative airflow room if available.
I copy that. You have a pregnant patient suspicious for COVID-19 with her one visitor out front. Is she masked?
Yes.
Okay, great. I have my surgical mask. I will check that room 208 is available. Okay, so I'm just gonna... Okay, great. Room 208 is available. I am coming to get them now. Great job. Hey guys, I'm going to the front desk to bring a pregnant patient suspicious for COVID-19 with her one visitor to the negative airflow room. Because I anticipate my contact to be greater than 2 minutes, I'm going to put my mask on. But because I don't anticipate your contact to be greater than 2 minutes, you do not need personal protective equipment at this time.
Thank you.
Yes.
Here's your mask in case your interaction is more than 2 minutes.
Oh no, thank you. I'm okay.
Okay.
Thanks. Hi, I'm Lindsay.
Hi.
I'm going to take you, you and your support person, to your private room to be evaluated. Please, both of you, keep your masks on at all times. Okay.
Thank you.
Thank you.
Follow me.
This is a beautiful labor and delivery.
Yes. What number baby is this for you?
First one.
Oh,
That's why we went to Italy.
nice. So here we are. All right. Just gonna open the door here. All right. Please go in and have a seat on the bed or the couch. In there while I notify your care team of your arrival. You guys can go on ahead.
Should we leave the mask on?
Yes, please leave a mask on at all times.
Okay.
Okay. If you could just close the door behind you, and we'll be right with you.
Thank you. Thank you.
All right, so we're closing the door. I'm gonna turn the negative airflow on. Okay, negative airflow is on. Next, I'm going to place our restricted access sign as well as our employee log right on the door. Okay. Hi, Dr. Zabo.
Hey, Lindsay.
I have a pregnant patient suspicious for COVID-19 in room 208 with her visitor. They are both masked, the door is closed, and the negative airflow is on. The restricted access sign and the employee log are on the door. I have selected Jen to be her designated nurse evaluator. Which physician would you like to designate to evaluate her?
Because I have no contraindications to evaluate a patient suspicious for COVID-19, I have selected myself to evaluate that patient. Do you agree?
Yes, I agree, thank you. Please now have your team notify the ID physician on call.
Please contact me about a pregnant patient suspicious for COVID-19. Hello. I have a pregnant patient suspicious for COVID-19 in room 208 with her visitor. They are masked, door is closed, negative airflow is on, restricted access sign is up, employee log is up, and I've designated a team to evaluate her. Proper triage and PPE protocol have been used. What are my next steps? Is COVID testing indicated for this patient?
Yes, it is. I agree with your management plan. I recommend an RT-PCR oropharyngeal swab. Great job.
I tell you, I've spoken with the ID physician on call. They agree with our management and to obtain an oropharyngeal RT-PCR swab.
Okay.
Let's do this.
All right, let's go. Thank you.
When entering the room of a patient who has tested positive or a PUI or person under investigation, you must put on your personal protective equipment. This includes gown, gloves, and mask with face shield. Donning PPE should be done in that order: gown, gloves, and then mask with face shield. Note the sleeves of the gown should be tucked underneath the gloves. Notice here, Dr. Szabo's sleeve is not tucked in under his glove. Jen notices this problem and corrects it before they enter the room.
Thank you. Sorry.
Yep, that's all right. All right, you look good. How about me? How do I look?
You look clear. Am I clear?
Clear.
Okay.
All right. And I'll check for negative airflow. We have negative airflow.
Okay.
Hi.
Hello. Hello, I'm Dr.
Hi.
Szabo.
Hello.
This is your nurse, Jen.
Hi.
Hi
Be
guys.
the team taking care of you. Thank you for always wearing your masks.
The first thing we're gonna do is get your vitals, and then we're gonna assess you and your baby.
And then we will test you for COVID-19. Do not leave this room unless we are with you.
I know this may be a scary time for you, but we're gonna take great care of you and your family and keep you informed every step of the way.
Thank you
Thank
very
you.
much.
You're welcome.
Removing or doffing PPE should be done by removing the gown and gloves together, turning them inside out, rolling them in a ball, and discarding them in the garbage inside the patient's room. Keep your mask on, exit the room, and close the door.
Wait, come back.
Once the door is closed, practice hand hygiene, and then remove your mask. You must remove your mask by touching only the ear loops or ties behind your head. Remove your mask, handling it only by the ties, and discard it directly in the trash. Do not touch any exterior surface of the mask or face shield. Next, wash your hands for 20 seconds with soap and water. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday. Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday. Happy birthday to you. Finally, when their hands are clean and dry, each person who has been in the room must enter the date and time and their name on the employee log.
I am now putting the date and time and my name on today's log. And Dr. Szabo will do the same.
Thank you for watching this instructional video. With your help, we can keep our patients and our staff healthy and safe.